Welcome everyone to California WIC Association's webinar on WIC Works. Today's topic is Citywide Breastfeeding Support, specifically Rancho Cucamonga's experience here in California. My name is Margaret Aumann. I'm your moderator for today with California WIC Association, and I'm here with our manager, Karen Farley. And we have Allison Foote here from Riverside County WIC and Department of Public Health to present on this topic, and we're very excited for seeing what Allison has to share with us today. So we're really glad that 30 of you have joined us, and probably more shortly, and I'll just go through a few introductory points. Just to remind you, this is we hope you've tuned in to discover about what it means to be a breastfeeding-friendly city, and who your partners might be if you're wanting to do this where you live, and give you some experiences from Rancho Cucamonga, California, and this effort. Just a couple notes if you're new to using GoToWebinar. Everybody is in listen-only mode, and we are recording the webinar. If you have any internet audio problems, you can dial in on your phone using the numbers on your confirmation email and also on the screen. Hopefully you can see it at this point. If you are connected by phone, please don't put your line on hold, but you can mute yourself using the control panel either on your phone or on your computer, depending on how you're connected. You can always go to support@GoToWebinar if you need to, but hopefully we won't have any technical glitches today, and you'll be able to see the slides and hear Allison and what she has to say. Just a summary of what California WIC Association, who we are, what we do. We're a nonprofit organization of the directors of local WIC agencies in California, and but because WIC is the Special Supplemental Nutrition Program for Women, Infants, and Children, and it's a federal program, we represent all parties, both statewide and federally, who have an interest in the operation of this program, and training and staff development, public education. We have a website, a newsletter, lots of things to keep people informed about what's happening in WIC and support the program, and develop partnerships with others who know the value of the program to women, infants, and children. For this webinar, we're going to take questions at the end of Allison's presentation. So to ask a question, just type it in the question box on your control panel. Be sure to press send, and we will screen them and send them over to Allison and have her answer those as time allows. So again, we are recording this webinar, and you'll find it on our webpage within a few days. So with that, I'll pass it on to Karen to introduce Allison.
Good morning, everyone. Thank you for attending the webinar, and thank you, Allison, for presenting and talking with us today. Allison is from Southern California. She's a registered dietitian and lactation educator, and she's worked for a long time with nutrition and breastfeeding for women, infant, and children. For more than 12 years, she worked at San Bernardino County WIC and in private practice, assisting with nutrition and breastfeeding and helping women achieve their personal breastfeeding goals. And that brought her a lot of depth and breadth of her comprehensive experience to complement her understanding of nutrition and breastfeeding. Currently, she works as a regional breastfeeding liaison for Riverside County WIC program. If you're unfamiliar with the WIC regional breastfeeding liaisons, they do community-wide work, forming networks, improving policies, working with organizations. It's very much on the spectrum of prevention, if you've not heard of that works to make organizational and systematic change in communities. It's very important. Allison strives to ensure seamless support for the WIC participants and improve awareness of breastfeeding support services throughout the community. A lot of folks really don't know the great services that WIC provides, and so this is an example of work that Allison is doing that is certainly outside the WIC's four walls. So thank you for being with us today, Allison.
Thank you very much, Margaret and Karen. I am so happy to be here to be able to share with you today about one of the most interesting and enjoyable projects that I've been a part of, which is the establishment of Rancho Cucamonga's lactation accommodation policy and program in the city of Rancho. So I'm going to go through a lot of information today. I'd like to let everybody know that if you have further questions after the presentation, please feel free to contact me. Today we are going to be discussing some items such as what does it mean to be a breastfeeding-friendly city. I'm going to talk about who can be an effective partner in this effort and how Rancho Cucamonga is promoting citywide breastfeeding support. As Karen mentioned, my role is as the WIC Regional Breastfeeding Liaison for Riverside County WIC here in the Inland Empire in Southern California. Regional breastfeeding liaisons are located throughout California. Our specific projects do vary according to gaps we've identified in our community needs assessments. But the overall responsibilities of each RBL are to narrow the breastfeeding support gaps in their communities, as mentioned, and improve awareness of WIC breastfeeding support services. The majority of the work that I do has been related to lactation accommodation, but I also work with a variety of other partners. And collaboration is really the key of the RBL role for the WIC program in promoting what we do. As RBL, I do connect with a variety of local health coalitions, and it is through the Inland Empire Childhood Obesity Task Force that the concept of breastfeeding-friendly cities really got off the ground. The picture you see on your screen is a selfie, which is kind of funny, but a selfie of myself and my partner in crime, Dr. Leslie Bramson. She and I worked to develop criteria related to breastfeeding-friendly cities. The criteria were largely based on California's lactation accommodation laws, but additionally breastfeeding and public laws, Civil Code 43.3. We began planning how to present the concept of breastfeeding-friendly cities to cities throughout Riverside and San Bernardino counties together. Coincidentally, Rancho Cucamonga, at the same time as we were developing these criteria and talking about this program, they had already begun to embark on developing an initiative and a lactation accommodation policy and program. So through the Childhood Obesity Task Force, we were able to connect with them. Just a little bit of information about the city of Rancho Cucamonga. It's a city with a population of approximately 170,000 people. It is a relatively new city that's experienced quite a bit of growth of actually 350% since it was incorporated in 1977. So it has had a fast rate of growth. Health indicators in Rancho Cucamonga do parallel those of the rest of San Bernardino County. Their obesity rates among adults are about 57% and among children of about 30%. But the great news is the City Council and city staff in Rancho Cucamonga do identify the importance of health promotion in their city, and consequently they have a very active Healthy RC or Healthy Rancho Cucamonga program. The Healthy Rancho Cucamonga program is a fantastic program. They have many great initiatives going for their employees as well as for residents in their city. The overall goal is to make the healthy choice the easy choice for all children and families in Rancho Cucamonga. Strategies that they use to achieve these goals is to change community systems. They really focus on system change to support healthy living, and as well as to significantly improve opportunities for active living and for healthy eating for children and families throughout their city. Healthy RC is a city council goal. Team RC works to support work-life balance for employees of the city. They have an active employee wellness program, and they also work to address poor community health indicators. So it's through the Healthy RC program that the idea for baby-friendly Rancho Cucamonga was born. What happened was the city applied for funding from First 5 San Bernardino as well as from the California Obesity Prevention Program to develop policies and programs related to breastfeeding. So those organizations are who provided the funding for this initiative. The large logo on the left is the logo for the program, which I love. And this logo is, I'll talk about it more in a minute, but it's what we will see on the decals that are going to be put in windows and of every city facility throughout the city to help support breastfeeding. Okay, so the process, what happened? What did they do to establish a breastfeeding-friendly city? Well, they organized through Health ERC. They organized a multi-departmental team. It was led by the city manager's office, primarily by a lady by the name of Erica Lewis Huntley, as well as a gentleman by the name of Mike Parmer. These two individuals were instrumental and very dedicated to developing this lactation support program, lactation accommodation program throughout their city. Mr. Parmer admittedly, he knew nothing about breastfeeding a year ago when we started this initiative, but now is truly an advocate for moms everywhere with regards to breastfeeding. He's learned quite a bit and is really doing amazing work to promote this through the city. Additionally, from the city, representatives from community services, human resources, the city clerk's office, the fire department, and public works services were also involved in the process of developing the rooms and developing the program. They engaged experts to give input about breastfeeding and lactation and what the requirements would be for a comprehensive lactation accommodation program. Loma Linda University and Loma Linda University Medical Center were represented, and Dr. Leslie Brampton works with Loma Linda. County of Riverside Department of Public Health WIC program, that's me, as well as San Antonio Community Hospital nurses and lactation consultants from that hospital were also involved in the process. The initial thing, the initial point that they wanted to accomplish in establishing the program was to really assess the current environment of lactation support throughout their city, then moving on to gather and analyze employee feedback. They developed policy recommendations based on this information that they received, and to develop recommendations for the mother's rooms that are located throughout the city. So with the comprehensive assessment, what was done initially were some key informant interviews. So Mike Parmer and other representatives from the committee interviewed departmental representatives throughout the city of Rancho Cucamonga. They interviewed lactation management experts and the representatives from the local hospitals to determine how this would actually work and what the key informants thought about a lactation accommodation program, if it was necessary, if it was something worthwhile for the city to do, which we of course know is, but we have to find out what exactly these key informants were interested in learning. We conducted a focus group with city employees. This was more specifically related to the lactation accommodation piece for city employees. We had a group, a wide variety of departments from the city, a wide variety of ages. We had some moms who were currently breastfeeding, who had breastfed, who had not breastfed, as well as some ladies who were grandmas and others who didn't have children but were just interested in sharing their opinion. And we did get some fantastic information from that group. Additionally, there were site visits performed throughout the city of the different facilities. We could go and see how lactation accommodation would work in all the city buildings. As I mentioned, there are 2 rooms in the city that are permanent lactation rooms, one at City Hall as well as one at a community center at Central Park in Rancho. And we went and we visited these sites with the facilities people and with other representatives so we could determine what was necessary to be done with those rooms, how to actually set them up. That would be the most effective way. Surveys as well. We sent out 300 plus surveys that were distributed to all part-time and full-time female employees in Rancho Cucamonga. The survey responses that we got were very interesting. I'll share some of the responses with you in just a moment. But it was really interesting, some of the feedback that we received, and it was essential. So some general findings that we got from employees of the city were that they agreed we needed to have support for working mothers, environmental support from colleagues, as well as managerial support was required. Designated spaces and permanent mothers' rooms were requested, and that was something that employees were interested in, as well as a balanced work life and family life. And that's a point that really came up again and again about the importance of balancing work life and family life, especially for a new mom who's coming back to work with breastfeeding and just having had her baby. And the city of Rancho Cucamonga really does focus on balancing the work life and family life, which is very nice to see. Some of the survey responses that we received related to worksite challenges, people expressed that there was no dedicated space for expressing milk. They wanted a private location, but they thought that more importantly a storage location should be provided. Some of the challenges for that time away from desks and a space to do it were the biggest challenges for one individual. And then not enough awareness by all of the time and effort it takes to pump. A lot of the respondents really felt that management and colleagues and just society in general didn't realize the effort that it takes for a mom to pump and work full-time. So that was something that was brought up as a point again and again. And again with the recommendations, training and awareness to all, including the community, of just what it takes for a mom to return to work and what it takes to maintain the milk supply. Another recommendation was simple information for supervisors to use and distribute would be helpful, and to make the City Hall Mother's Room a little more cozy atmosphere, which we have done. So taking all of the information that we received from the surveys, from the key informant interviews, from the focus group, from the site visits, we really put together a comprehensive policy for the City of Rancho Cucamonga. I'd like to highlight some of the most the important points, or what I thought was somewhat unique in some areas for the lactation accommodation policy for the City of Rancho Cucamonga. Some of it is general, but some of these points are unique. Related to time and scheduling, within the policy, it is recognized that the frequency and duration of breaks will likely vary according to the needs of the mother, so it's not a standard break time, standard amount. There is recognition that it does change from woman to woman. With facilities, it's designated in the policy that every city facility will have space available for employees to express breast milk, that the space will be in compliance with state and federal law, and of course that means not a bathroom, so that's identified as well. There are 2 permanent mother's rooms for employee usage, as well as for public usage, which are equipped with necessary equipment and supplies. In the policy as well, there are employee responsibilities designated, which we felt was also very important, that moms have responsibility to their employer to communicate with HR and supervisors regarding her needs and the changing of needs during the period when she's pumping and working. The mom would also be responsible for maintaining the space, for example, keeping it clean, as well as for proper storage of the breast milk. With employee education, the City of Rancho Cucamonga has committed to train supervisors and managers on state, federal, and city policies. They have a resource library with materials on breastfeeding, parenting, maintaining a balanced work and family life, as well as, of course, working for WIC. I am very excited about this, that they will provide information, including information about WIC, First 5, and breastfeeding support to all employees, both male and female, prior to maternity leave and family medical leave. So they will be providing information packets to all of their employees. Community education. This is a piece that I feel is somewhat unique to the policy for Rancho. It was very important to me that we not only use the Breastfeeding Friendly Cities program as promotion of lactation accommodation for employees, but also to use it to promote the normalization of breastfeeding to city residents by identifying buildings as breastfeeding friendly, as well as to training staff to know about a woman's right to breastfeed wherever she may be. I feel like this is a step towards reducing the embarrassment barrier. It doesn't solve all the problems, but at least having this signage at the city facilities to designate these areas as supportive of breastfeeding, and for moms to know that staff are not going to be asking them to move and that they will support them, I think it's a very important thing. Information promoting breastfeeding education, support, and location of mothers' rooms will be made available at all city facilities on the city website. They have a mobile app, RC2Go, which will have breastfeeding information, as well as the Grapevine, which is the city newsletter that gets distributed to city residents. And in the policy as well, it states that August will be proclaimed as Breastfeeding Awareness Month, and more promotion will occur during that time. Additionally, in the policy, we've outlined an objective of an atmosphere of support. The policy states that the city will foster a supportive, both physical and social environment for breastfeeding moms. They will provide support for employees transitioning back to work and maintaining a balanced work and family life, and that discrimination and harassment of breastfeeding mothers is unacceptable and will not be tolerated. Compliance ensures adherence to the policy. It outlines resources and options for employees who feel that they have been discriminated against or harassed. And these are points that we felt were important to put in there, just to relay the importance of breastfeeding and the support from the city, from the top down, regarding this policy. Okay, so that's an overview of the policy itself, and I'm very excited to announce, and many of you may have heard this already, but the Lactation Accommodation Policy and Program, it was approved by City Council on May 1st of 2013, and it is actually a city resolution. It is a resolution to establish a lactation accommodation policy and program for the city. Currently, what's been happening since this has occurred is that the policy has been distributed to all employees, and all parties involved are really busy getting the training program ready for all city staff, and as well as putting the information on the website, et cetera. The permanent rooms are open for employee and public use. The window decals with the beautiful logo are being distributed to city buildings, so things are moving along. It's been a very fantastic experience working with Rancho. It really is an example of true collaboration, as I mentioned, with all of the people involved at all of the different levels and from a variety of backgrounds. It was very interesting to me, the conversations that we would have, because everybody from the gentlemen who work for facilities to fire to HR, everybody had a story about somebody that they knew who had breastfed or had problems breastfeeding or was successful. Everybody had a story to share, which was really nice, because we were able to really come together and promote that based on our experiences and our desires to help these moms with achieving their breastfeeding goals. So that pretty much concludes the information that I wanted to present today. My contact info is on the slide that you see in front of you. And I guess if we have questions, Margaret and Karen, I'm happy to answer any questions right now.
We did have a few questions. Thank you, Allison. That was really informative.
Great.
You mentioned that the rooms have equipment and supplies.
Yes.
And can you describe that?
Sure. The permanent mothers' rooms will have hospital-grade pumps, and the employees returning to work so far will be provided with a pump kit. Each individual will be provided with a pump kit. Additionally, there's a nice nursing chair, rocking chair, There are microwaves, there are fridges, there's shelving, there's soft lighting, there's a mirror. They've done a really great job in designing these rooms to be efficient and having the actual equipment for pumping, as well as to create a relaxing environment for moms to just escape and be able to focus on one thing, which is pumping milk for their babies.
So that sounds like it also involves their health benefits. Are they getting their kit through their health benefit, or?
I think some of the grant funding was used to purchase kits so far. Health benefits, that's not something, I don't think that's been explored so far, but it is something that we have been talking about in providing that information.
Okay.
So it's just being provided by HR, I guess, through the Health DRC.
Well, I guess it's supposed to be provided in the Affordable Care Act, so maybe that's the next chapter.
Yes, and I could use your help with that information, Karen.
And then the rooms, the couple rooms that are for the public, can you describe what you mean by the public and how they would work?
Sure. At City Hall and at Central Park, these rooms that are also designated for employee use are used for public as well. So if a mom happens to be at Central Park and needs a place to either pump or bring her baby to breastfeed, if she'd like a quiet area, these rooms are open for public use as well. And each of the facilities has a protocol that they've worked on to determine, they have a schedule if a mom is an employee in pumping. But people have access to the schedule so they can see if it's available for use. So if you're at City Hall or at the park and you need to breastfeed your baby and you'd like a quiet place to do so, then those rooms are open for public use.
So maybe this isn't an important point, but I'm just curious how the public has access to that room and what kind of monitoring there is of that room for, people getting in there who wouldn't want to be in there, or maintenance of the room, or?
Sure. What maintenance is involved in that, they are checked regularly. If a mom wants access to the room, they're locked. So she would have to, for example, at City Hall, she would have to speak to the person at the main desk there to get them to open the room, and the same as at Central Park.
Yeah, okay.
So it's monitored that way, and
okay.
There's a key that they can use to open the rooms, and then they would bring the key back.
Great.
So it's not open all the time. They would just have to ask.
Yeah, but there is some sort of city employee who's actually kind of monitoring access for just anybody, it sounds like.
Yes, city employees.
Okay, 2 other questions. Has the possibility of allowing moms to bring babies to work come up for city employees?
It has. As far as I know, that's not something that they're leaning towards right now. So I think, for me, I would love to see babies at work, but I don't think that's something that they're going to do at this time.
Okay. And can you talk a bit more about encouraging the balance between work and family life?
Sure. Well, some of the information, the books and resources that they've talked about, well, first of all, when a mom is returning to work, she's contacting the HR representatives as well as her supervisors, and at that time they distribute information about pumping and maintaining milk supply, and information about also scheduling and the possibilities of flexibility in scheduling for employees to make that transition a little easier. And it sounds to me like the city is open to doing that, to helping moms make that transition a little more easy when you're returning to work. So pretty much it's providing those resources and having the conversations about what would be the most effective things for moms as employees of the city to help them get back to work and to help them feel comfortable with pumping at work.
Okay, great.
Mm-hmm.
Another question is, what would be your recommendations for print materials, signage, and other products that a Department of Public Health might provide to support these efforts? Signs for buildings, rooms, mirrors, refrigerator magnets, support info?
For just distribution to the public or for just signage to have?
For print materials, so that would probably go to employees, and then signage, of course, would be seen by everybody.
Sure. We're distributing a lot of the WIC materials. So all those beautiful pamphlets that we have that talk about the baby behavior campaign. So we're giving links to our WIC website, wicworks.ca.gov, with all of the info about breastfeeding and how to maintain milk supply and what to expect in those first weeks of breastfeeding. So those print materials are being distributed. Additionally, the signage is pretty much being covered by the decals right now. The information that's being put online, I'm not exactly sure how that's going to look, but it would likely include links to websites. We've also given recommendations, of course, for information on National WIC Association website, California WIC Association website, so all of those varieties of materials. Rancho is, they have also, from my understanding, received funding to promote the program a little more, so that's something they're working on, perhaps doing some sort of media campaign. I could provide that information at a later time, what that campaign is actually going to look like. They had talked about developing their own posters and their own billboards and et cetera even to talk about the fact that Rancho Cucamonga is a breastfeeding-friendly city.
Excellent. We have a couple more really excellent questions here. These have all been really good, so even though it's 11:32, I'd like to put them out there.
Sure.
Do you envision other businesses, such as restaurants and stores, using the decals?
I do, and that's part of, with my work as Regional Breastfeeding Liaison, that's part of what I see into the future. The point with breastfeeding-friendly cities is really to start at the city level with lactation accommodation and breastfeeding and public information. But I personally would like to start moving into businesses within the city, working with the local chambers of commerce, working with anyone who's associated with a certain city. Additionally, I'll just give you a note about what we're doing in Riverside County through our Riverside County Health Coalition. We have a goal of helping 15 cities throughout our county adopt healthy city resolutions within the next year. And part of those resolution templates that we're suggesting is to include lactation accommodation. So, and that's for employees, for city employees, as well as exactly what Rancho has done with breastfeeding in public. So what I envision happening is for us to work with the cities, and then through the cities create partnerships and gather more information about businesses that function within the cities to talk to them about the importance of lactation accommodation and, here in California, the laws associated with that.
Excellent. And so you touched on basically, I think what will be our last question here, which is involving other cities and how people can get information about this. They do have your email here as far as more materials or questions, but one of the questions is this designation. Are there other cities, or is there national recognition for breastfeeding friendly cities? Is this something that you're developing? Will you be sharing it? I mean, most of us are familiar with baby friendly hospitals, but beyond that, as far as an accepted designation, do you have any thoughts about this as being sort of a recognized designation?
As far as it stands right now, I'm not aware of any national recognition. The Breastfeeding Friendly Cities designation that we're working with is really here on a local level that we developed through the Inland Empire Childhood Obesity Task Force. So the criteria that's been developed and the supporting information. We also have materials about training. We have PowerPoint presentations. We have handouts that we use when we're going to be working with the cities to help them achieve the criteria that we ourselves have set. So it's not anything nationally recognized, but here at a local level, it's a local recognition. I would love to see it nationally. I'm happy to share it nationally because I really think, this is important, and it's been a great experience to work with the cities and to engage people who really knew nothing about breastfeeding before, and it's not really something that they think of. But when we start talking to them about the business case for breastfeeding and the health benefits and the economic benefits and the environmental benefits, it opens a whole new perspective and a whole new level of support that may not have existed before. So if somebody would like that information and the set criteria that we've developed, I'm happy to share.
Great. And your contact information is on the last slide that people are viewing right now. And if you misplace that, this will be posted on our website, this webinar, the recording, and the slides, and they can always contact us. So I think that's a great way of summing up your pioneering efforts and the high quality of what you're doing there. And if you had any other comments you wanted to share with us, otherwise I think we'll close. But thank you and all your colleagues there for your really important and pioneering efforts to bring breastfeeding into the world of wellness and community awareness. But did you have anything you wanted to share with us before we close?
No, I think we've pretty much covered it all. I just want to say thank you for the opportunity to share this information. These webinars are a really great resource, I think, for people across the country, so thank you.
Thank you so much, Allison, and thank you everybody for attending and hanging on with us for a few more minutes as we got some really great questions. Thank you for your participation, and we'll look forward to having more webinars in the future. Although we don't have any currently planned, I'm sure we will shortly. So thank you for joining the California WIC Association.